If your knee pain keeps coming back every time you ramp up your training, you're not just unlucky. There's a specific reason it keeps happening, and it's probably not what your physio told you. Hi, I'm Liam Stapleton, specialist in Podiatric Sports Medicine and lower limb injuries. I'm based in Kent and London on Harley Street. In this video, I'm going to break down why runner's knee is one of the most recurring injuries in sports medicine and why the standard advice keeps failing people. So runner's knee isn't strictly a diagnosis. It is an umbrella term that encompasses several anterior knee pains. So these can include commonly patellofemoral syndrome, patellar tendonitis, and other anterior knee problems, including Hoffer's pad impingement. The key to remember is that each diagnosis has a different treatment plan. Getting the diagnosis right is really important so that we get you on the right treatment plan, or your injury won't heal. This means that if you've been treated for a runner's knee previously, you may have been on the wrong treatment plan. This may be why pain keeps coming back. The most common reason that the pain keeps coming back is because the cause was never addressed. Some people treat this with rest alone. What happens when you rest is the pain does improve, but that as soon as you get back to running, the pain comes straight back. Very often, the rest has alleviated some of the inflammatory symptoms, but also decreases your capacity. This means that it takes less running load for your symptoms to return. So most commonly we think that runner's knee is patellofemoral syndrome. And patellofemoral syndrome is where we get pain and potentially inflammation under the kneecap. The common reasons are often biomechanical. We know that several factors interplay that can cause this. We know that people with an overpronating foot or a flatter foot type are prone to this. Any patients whose knee falls to valgus or their leg internally rotates, and this is associated with a pronation movement of the foot, are commonly prone to suffering. Patients who have the drop of their pelvis or during stance phase or on single leg squat are most likely to suffer. We know that a weakening of the vastus medialis fibers that control the medial movement of the knee can predispose people to this. Other factors that are more difficult to treat are the tightness of your iliotibial band and the shallowness potentially of the groove under your kneecap that holds your kneecap in place. There are some external factors that also interplay with this. Training load is really important. Anyone who increases their load too quickly can be prone. We know that ladies are more likely to suffer than men. Your choice of footwear also can predispose this, both footwear not supportive enough for you or footwear that have seen their best days and is now beginning to show terminal wear and tear will also not protect you from this. Patients running on the road and not adjusting for the camber on the road can be more prone to this in one leg than the other. And we know patients on downhill runs can increase their patellofemoral load. The correlation with foot posture and foot mechanics with patellofemoral syndrome is well documented. The two things I think are most important. We know that the flattening of the medial longitudinal arch and the overpronation movement associated with this causes an internal rotation and a valgus movement of the knee, which drives the patella, the kneecap, laterally. This is one of the things that can cause this. We also see patients who have poor propulsive mechanics through their foot when they push off, also prone to the same pronation movement through this that can internally rotate the knee. These are two important factors to address when looking to get on top of your patellofemoral syndrome. When I'm assessing a patient complaining of runner's knee, we're looking to make a solid diagnosis. History taking, looking at patterns of pain, exploring the patient's running history, looking at footwear, and then moving on into clinical exam, looking at patient's knee, potentially clinical tests around the knee, looking at their mechanics in a non-weight bearing perspective, moving into a weight bearing assessment where we're looking at static individual tests, differences in symmetry and muscle balance, and then moving into a biomechanic gait assessment where we might look at a patient walking and potentially looking at their running mechanics. So treating patellofemoral syndrome will depend on which of the predisposing factors you have. A thorough assessment should identify which of those factors are relevant to you and then going about modifying any of those factors that are modifiable. Easy treatment options, looking at running shoes, their life expectancy, and any modifiable factors to look out for, possibly with recommendations in running shoe specific to your needs. We know that custom orthoses have a proven track record, certainly for patients who have a flatter foot posture or overpronating. Research shows these offer good symptom relief, at least in the medium term. Exercise rehabilitation, which can include physiotherapy, to improve muscle strength and muscle control of any of the weak areas we have highlighted during assessment. Gait retraining, if we highlight that your running gait predispose you to this sort of injury, we can change that. We know that by increasing cadence and reducing stride length can play a big, important part in overcoming your patellofemoral syndrome. But ultimately, there's no one-size-fits-all treatment program for this, and depends on your assessment, your diagnosis. So when should you worry and when should you not? There are several warning signs that every runner should look out for to seek urgent attention. A knee that is locking or giving way are important signs of potential intra-articular pathology. A knee that is swollen very quickly after injury, usually within minutes to an hour, that needs to be scanned. I tend to worry less about pain around the kneecap that settles with rest. This is unlikely to cause lifelong changes within your knee, and we can usually continue to train whilst you recover. So if you're dealing with a knee pain that keeps coming back and you want a proper assessment rather than generic advice, the link is in the description. I see patients across London and Kent, and I do offer remote consultations as well. If you found this useful, hit subscribe. I put out videos on lower limb injuries every single month, so drop me a comment if there's a specific condition you want me to cover next.